So my name is Semple. I'm the board chair of the Colorado for Universal Healthcare, and I want to welcome you all here. And I want to say a few words about single payer.
I'm going to be here so that you get recorded.
Okay. When we talk about healthcare, it's easy to get very complicated very, very quickly. So it's important to have the simple message also, and that is we can cover everyone here in Colorado, spend less money for better health care in a way that each of us can afford. It gets really complicated after that, but that's the simple message. We can do this. And the way we pay for our health care now is we're really in an abusive relationship with how we pay for our health care. Compared to the 30 plus other countries that have a universal health care system, we don't live as long. Infants and mothers die in childbirth much more often in the U.S. than in other countries with universal systems. The rates of deaths by preventable causes is much higher in the U.S. than in other countries. This is an abusive relationship, and we need to change it. We can do better. We can cover everyone in Colorado, spend less money for better health care, and in a way that each of us can afford. And this is not just a pipe dream. About 6 years ago, the Colorado legislature passed a bill that funded the Colorado School of Public Health to do a comparison analysis. They looked at how we pay for health care now to a universal multi-payer system, which would basically add a public option to how we pay for health care now, and comparing that to a single not-for-profit public fund for the mostly private delivery of health care. And the good news is that the report that the Colorado School of Public Health came up with, it showed that yes, indeed, we can cover everyone, spend less, and have better health care, and in a way that each of us can afford, and it would even boost the economy of Colorado. It showed that clearly. This is not a pipe dream. We can do it. So this calls for a fundamental change in how we pay for our health care. And that challenges a quality that all of us humans share, that we tend to overvalue what we have, and we hold on to it like this, and even if it's not working for us very well. And we undervalue what might be very different, but would work much better. So this is a fundamental challenge. And some abusive relationships are difficult to get out of because our needs remain. We still need health care, but we need to make a significant transition. So you've all received a copy of this in your, it's in Espanol, Inglés, and this has 10 essentials that we've developed that need to be part.
It's pink in our package.
Oh, it's different colors? Okay, but
For some of us, it's pink.
okay, so we're multicolored. So we've used those 10 essentials to develop legislation that, we worked on it for 3 years, and finally the good news is that the governor just signed a few weeks ago a bill to implement, to engage the Colorado School of Public Health to be doing an in-depth follow-up analysis of a single system in Colorado. And that's really going to inform our work going forward. So making this significant transition that we need to make, it's going to take a combination of strong leadership and an informed grassroots demand among the people of Colorado for the kind of health care that we need.